Welcome back with our very disjointed pandemic response on testing and, if necessary, treatment, and now a really confusing vaccine program that seems to pinball between healthcare providers and counties and municipalities. Some have wondered if this is a good time to talk about single-payer healthcare. What kind of difference would that make? It has a strong advocate in the former health director for the city of Detroit, former gubernatorial candidate Dr. Abdul El-Sayed, who, along with Micah Johnson, has written a new book called Medicare for All, A Citizen's Guide. And Dr. El-Sayed, good to have you back with us on Flashpoint. Good to see you again.
Always great to see you, Devin. Thank you for having me today.
You bet. Before we get to the book, as a former public health official and an epidemiologist by trade, give me your assessment of where we stand right now with the pandemic.
Now, I'll be honest with you, this is a treacherous time. On the one hand, cases are down, and they're down considerably all over the country. Hospitalizations are down, and deaths are starting to creep down too, and that's a great thing. At the same time, we have these variants, and these variants, we know, have different levels of resistance to our own acquired immunity that people get after they've gotten the illness, which means that they could spread quite rapidly. And so we're in a moment right now where we've got good news, but we've got to keep it good news. And what we need to do is continue to follow basic public health protocols as we roll out these vaccines. We got to remember that the vaccines are a really incredible engine. It's like a McLaren X1 engine, but you can't drop it in a Ford Pinto. And so we've got to keep doing the rest of the work to contact trace, to test, to socially distance, to wear our masks, to wash our hands, to make sure that we can beat these variants too and hopefully get out of this.
It's hard to argue by almost any measure. The United States has had one of the more maladroit responses to the pandemic of the entire world. Do you think that that has to do more with our healthcare system and the way that we sort of mete out healthcare in America, or was it simply a government response that wasn't ready for what happened?
You know, I see these two things as one and the same. In our country, we're one of the only high-income countries in the world that treats healthcare more as a business than as a right. And when you have a number of huge industries, some of the biggest sectors in the country involved in the business of healthcare, there's very little incentive to prevent people from getting sick in the first place. There's a lot of money made off of people getting sick. And so we don't invest in basic public health infrastructure in this country the way that other countries do. And so our response was anemic, and it was anemic because we haven't invested in those things that we needed to be able to beat pandemics before they come. And then when it hit us, our healthcare system, because of the way that it's set up, is rickety. It's like the house of straw that blew over when the big bad wolf blew on it. And that's because, you know, again, it is all about a business. And so we saw hospitals without basic PPE for their employees, the frontline healthcare workers. We watched as people lost their health insurance because we tie health insurance to employment in this country. 15 million people lost their health care while they lost their jobs in the middle of the worst pandemic in over a century. And we still can't figure out how to deploy this medical marvel of a vaccine at any speed simply because we don't have the infrastructure to have done that. And that's all because of the way that we've chosen to pay for and think about healthcare in our country. Meanwhile, 10% of people, even before this pandemic, didn't have health insurance at all.
As you, though, now try to make the case for Medicare for all, what you run up against is people say, well, look how inept the government response has been to this, that government doesn't, you'll hear this time and time again, government doesn't run anything very well. Why would we turn something as important as our healthcare system over to be government run?
You know, we make a choice in this country not to run anything in government very well. It's because we don't invest in it. It's because we think about government as part of the problem rather than part of the solution. And part of this is to say, well, actually, government is uniquely situated to solve a set of problems in our country that cannot be solved by markets as a function of how markets work, right? And, you know, I always, when I teach on these issues with young people, I always ask them, how many of you would buy 5 MRIs for $500 right now? And most of them say no. And then I said, okay, well, if you were playing basketball and you tweaked your knee, if I sold you 1 MRI for $500, would you buy it? And almost all of them say yes. The point here is that we don't want to buy health care. We want health. And after you hurt yourself, after you get sick, health care is a means to getting health. What that proves to you, right, is that health care is not a market good. healthcare is something that we ought to think about as a right that we provide to every single person in the richest, most powerful country in the world. And so we've got to rethink this situation, and we've got to rethink the way that we invest in government. Government doesn't have to be run poorly. It's a choice that we make by people who want to tell us that actually the market can always do it better, even as we watch the market fail at solving these basic questions.
Well, clearly our system is inefficient. We spend more on healthcare than just about anybody in the world for not terrific results and outcomes. But the fights that we have seen at places like the nation's capital, at the Michigan State Capitol, I've gotten so many emails over the last 4 years from people saying, I don't like President Trump, but I fear the encroachment of socialism more than anything in American life. I'm wondering, even though this is a very old idea, John Dingell famously introduced it every year at the start of every congressional session. This is an old idea, but is it further away from being done rather than closer simply because of this massive pushback against anything that approaches socialism?
Yeah, I hear that question. I actually think we're a lot closer than we've ever been, simply because, you think about the median individual. We talk about a young woman, a Michigander actually, named Lisa Cardillo. She was 36 years old when she had a very rare form of heart attack. And that was 3 years after her husband had suffered a brain tumor. And they had good health insurance through his employer, so they thought, until they actually had to use it, in which case they were facing bankruptcy because of the cost of a deductible, a paywall that health insurers put up to get the health care that you already paid for in your premiums every 2 weeks or every month. And so the people all over the country, all over our state, are realizing that the system is just not working for them. I hear you on the scare word socialism, but here's the thing. People like to talk about this as a quote unquote government takeover of healthcare, but the doctor that you'd see, the hospital that you'd go and get healthcare from, they'd remain private. What differs is the middleman that we allow to exist in our system, taking $15 off the top of every $100 that we spend in health insurance. Health insurance doesn't have to be a good. It doesn't have to be something that you have to worry about keeping. It can be something, just like our neighbors to the north know, that is provided by government so that you can then take that voucher and see any private doctor or hospital that you want. That is not socialism. That is just a smart approach to government. And by the way, we do a lot of public things really well, and we take them fully for granted, like roads or schools. And we all know that if we did not do them well, that it would create a huge equity challenge. Lower income people in rural communities all over this state and country, urban people all over cities wouldn't get what they deserve. And they frankly aren't getting it now because we're not investing in those things. And so I don't hear the question of socialism, I think, is a bit of a buzzword that people throw up to try and turn us around. But we need to look through that and actually ask the question.
I got just a couple of seconds left. President Biden and others have talked about creating a public option rather than going all in. Is that workable, or does it have to be all or nothing?
Well, look, I believe, I played football in high school, I believe that you can kick a field goal and come back and try and score for a touchdown. And I think we shouldn't take our eyes off the prize, even as we're trying to expand health insurance for folks in a public and an effective way. And so I can support a public option and support Medicare for all at the same time.
It's a really solid debate to have, and especially given the times that we're in. I so appreciate having you back on Flashpoint, Dr. Abdul El Sayed. Good to see you again. I hope we'll continue the conversation down the road.
Devin, it is always a privilege. You stay safe, and everybody out there, make sure you wear your mask and wash your hands. We'll get through this.
You got it. We'll take a quick break. Back with more on Flashpoint right after this.